Hi, this is Dr. Erica Onigbola, and I am joining you again on today concerning the new Alzheimer's disease medication, which is called the Lacanemab. It is newly on the market and it has been accelerated and approved by the FDA this month. And it is a medication along with previous um, Alzheimer's disease treatment medication regimens that is to help improve symptoms. Is not a cure for Alzheimer's disease, just to reiterate and let that be our basis here. There's no cure for Alzheimer's disease. Alzheimer's disease, as we know, is indicated by loss of neurotransmitters, loss of memory, could be due to cholesterol increase, could be due to lack of essential essential elements that help the cell production of neurons in the cognitive area, and also it can be due to oxidative stress as well. So Alzheimer's disease, as we know so far, is not curable at this moment, but is treatable as far as symptoms. And so the new medication, lecanemab, is indicated for patients with mild to early stage Alzheimer's and dementia, and it is indicated for that particular population because clinical trials have been shown to reduce the progression or cognitive decline in that particular population. Now, the older medications, which is NAMENDA and the Aricept, those medications, again, are not curable but have been able to treat Alzheimer's disease by reversing the degradation of neurotransmitter acetylcholine, and also help to increase the synaptic spark that may be lost during dementia in mild, moderate, and severe stages of Alzheimer's disease. So with those medications, they have been on the market for several years now, and I have been able to dispense those in previous years. And I wanted to just bring up those medications, Aricept and the Namenda as well. And they are still on the market, and they are oral medications. They are oral medications taken particularly during the day, and they are, unlike the new medication that lecanemab, which is an IV injection every 2 weeks, and it is a injectable medication solution versus the older medications, which are, again, tablet oral form. This particular lecanemab is a medication that is new in its class because it is said to slow the progression of Alzheimer's disease, slow the progression. Side effects could be infusion related reaction. It can be headache and also deposits of swelling and bleeding spots on the brain. The cost is relatively expensive and is not one that might not be readily covered by the pharmaceutical insurance companies. So it was approved again on January 6th and FDA approved via the accelerated approval pathway. And it was known to show a significant decrease in the amyloid plaques, which is signature to Alzheimer's disease patients. The amyloid beta plaques are deposits of plaques that sit on the neuron, and once those sit on the neurons cannot properly transmit signals throughout the brain for proper memory functioning and daily functioning as well. So by the lecanemab, being injected, that is said to reverse the plaque deposits. And so that is new. That is new to the Alzheimer's in the field of pharmaceuticals, and so new to the disease. And so we want to just make mention of that versus the older medications. And also there are also supplements that are over the counter, such as the Prevagen and the Nariva. Also, lion's mane is another supplement, and those medications can be picked up over the counter and can be utilized along for patients who just need an extra stimulation of their memory and functioning. Okay, so uh, FDA is an agency under the U.S. Department of Health and Human Services, and they set the standards. And they have found that this medication is produced by a Biogen manufacturer, is a well-known candidate for improving symptoms. Again, it's only to improve symptoms, to slow down the symptoms of Alzheimer's disease. And so that warrants us giving out its props, and just letting people out there know that it is available now, and of course in time can be more cost effective with clinical trials, post marketing trials, things like that, to help insurance companies understand its benefit over its risk, and that uh, it is a better choice over the previous classes of drugs. So I am glad to give out whatever information I can give about pharmaceutical latest updates, and also medications that help to improve the pharmaceutical field as well. And if you have any questions or comments, or would like to see more videos about what we have in pharmacy, please leave any comments that you would like, and any suggestions, and I'll be happy to revisit those for you. And I'm glad that I was able to get on the live chat today, and I hope that you will join me, and I hope that everyone has a great a great day today. Again, today is Martin Luther King Jr. holiday, and by that day being a holiday, we want to just reiterate Millennium Pharmacy, myself, Dr. Erica, want to reiterate that we love each other, respect each other. Not only that, but just go above and beyond and helping each other, unifying our communities, unifying our neighbors, our neighborhoods, our nation, our global network, just being forgiving and loving and merciful to others, doing unto others as we want them to do unto us. And just remember to take this day not as a day just to relax and to vacate or vacation, but a day to just do our best, do our due diligence at ensuring that we are taking care of ourselves and loving each other, whether we're any color, any race, any gender, that we are treating others as we treat ourselves. Okay. And that is my platform. Please visit my website, themillenniumpharmacy.com. Visit me on TikTok. You can leave comments, suggestions. Please visit me also, not only on TikTok, but on Twitter as well. Cash App. I am receiving cash as well through Cash App. Then there are over-the-counter medications, such as diabetic medications, or I'm sorry, vitamins and minerals. There are medical devices. There are that I sell on my website, themillenniumpharmacy.com, medical devices, hygiene and healthcare. There are vitamins and minerals, antacids, utensils for disabled individuals who may need to utilize special eating utensils. There are pill cutters, pill boxes. There are that I sell. There are urinals. There are shampoo basins, and there are meal eating trays, canes, walkers. If you know anyone that may need any type of medical device, please leave a comment or a suggestion, and I'll be happy to visit that and look into ordering more supplies and more medications that can help with you and your loved ones. Okay, so please visit my website, and I have all those things on there for you to enjoy. And I have hope you enjoyed today's video. And there are other videos as well. Lacanemab, particularly that I did a video on that, the new drug for Alzheimer's disease. Thank you for joining me, and I hope to see you on the next video chats. Goodbye and peace.